All right, friends, it's time to give you loyal listeners a discount on protein powder. You may or may not know, but I launched my very first protein powder 2 years ago. It's a grass-fed beef isolate with only 3 ingredients: grass-fed beef, either organic cacao or organic vanilla, and organic monk fruit. Now, if you don't want any of the added flavor and sweeteners, you can also just get unflavored. And no matter what flavor you choose, you're getting over 23 grams of protein per scoop, which is going to keep you full and satisfied between meals. I love starting my day with a Fab4 smoothie and breaking my fast with that much protein. It makes a serious difference in my cravings and blood sugar balance the rest of the day, and I've seen it with my clients as well. Now, I never thought I'd own a product company, but when I got pregnant with Sebastian, I realized the majority of protein powders were chemically extracted or enzymatically extracted, and I wanted to use heat and water only. I wanted minimal ingredients because we don't need those emulsifiers, fillers, or added vitamins, minerals, and probiotics. All of those additions increase the chances that it's not going to work for your body, whether it be bloating, digestion issues. I just wanted pure, clean protein to keep you full and satisfied so you could build the most delicious Fab4 smoothie. And I have to say, I'm pretty proud of the flavor. If you take a look at our reviews on Amazon, you'll see 5-star reviews for flavor. And that is key, because if you don't love your Fab4 smoothie and you don't love drinking your protein powder, you're not going to do it. It won't become a habit, and it's consistency that outpaces everything. So if you're here and you're listening and you want to give our protein powder a try, use the code podcast5 for $5 off your order. And let me know if you love it. My favorite ways to apply this protein powder is in my Fab4 smoothie, making freezer fudge, making chocolate milk, making hot chocolate, and throwing the unflavored into all my kids' baked goods. So let me know how you use it. Let me know if you love it, and share this podcast deal with your friends. I'm so excited for today's guest, I can hardly handle it. Dr. Jolene Brighten is a prominent expert in women's medicine, a nutritional biochemist, licensed naturopathic physician, and the best-selling author of Beyond the Pill. A fierce patient advocate and completely dedicated to uncovering the root cause of hormonal imbalances, Dr. Brighten empowers women worldwide to take control of their health and their hormones. She's an international speaker, clinical educator, medical advisor within the tech community, and considered a leading authority on women's health. Dr. Brighten is also a part of the Mind Body Green Collective, and she's been featured in the New York Post, Forbes, Cosmopolitan, Huffington Post, Bustle, The Guardian, and ABC News. I love her for breaking down female hormones online and on her website. She makes it accessible for people to understand the root cause of diseases like polycystic ovarian syndrome, endometriosis, and infertility. It is such a pleasure to invite her on the show today. I'm so excited to have her as a guest, and I know you guys are going to love her energy. So I hope you really enjoy this one. I'm so excited to finally welcome Dr. Jolene Brighten to the show. I have been an Instagram follower for such a long time, and I've sent a number of my clients who have hormone imbalances to go check out her stuff. And it's just such a pleasure to have her in the room. I think she's the perfect person to take us back to the basics of sex ed and what's happening with our hormones throughout our 28-day cycle, if it's 28 days, and talk about some of the issues we see in hormonal imbalances and how to correct those. So, Dr. Brighten, thank you so much for joining me.
Yeah, well, it's a pleasure to be here. I've been following you on Instagram as well. And I feel like that's how it goes sometimes. It's like we're corresponding forever on Instagram or social, and then we get on and we just like start having a conversation as if like we've known each other forever. One of the benefits of social. I know it's got its downfalls, but I've made a lot of friends through Instagram.
I know. It is really great, especially people like you who are putting out really solid, scientifically backed information and giving people the tools that they may not be getting in their 5 or 10 minute doctor's appointment.
Absolutely. I mean, and that's the thing. It's really, my mission is, one, you shouldn't have to go to medical school to understand your body that you live in. And that was me. So if that's you, no worries. Like if you're like, I don't understand my body. Like I had a chemistry degree, I got a, nutrition degree, and then I get to naturopathic medical school. And I'm like, wait a minute, I can only get pregnant one day out of the month. Like I've got this window, and what is this? Like, and that was like in my fertility class. So I want people to understand their body understand how to work with their body. I want to end that rhetoric that like being a woman is inherently awful. And the only way to keep up with your male counterparts is to suppress your period and act like a man. And it's like, no, you are a badass goddess in yourself. Your hormones are designed to give you superpowers, and you can really, shine, and you complement the male counterpart, right? If we're talking binary, they have their strengths, we have our strengths, and together, like, we can really create some phenomenal change. And so it's about leveraging your own strengths. And the other part of my mission is that I want you to be so educated about your body, how things work, and really have like that edge so that when you go to your doctor's appointment, you can get the most out of it. Like, you know how to get in, get what you need, make sure that like your doctor is working with you and not just telling you what to do. Because yes, those doctors still exist who are like, I wear a white coat and I have a stethoscope. They have and they're like really smart. But yeah, and sometimes they're just like, don't question me. Do what I say and don't question me. I don't believe in that at all. I'm like, it's your body. You know it's normal. You know it's not normal. And you need to question everything. And how we get you to that place is you need to be educated about you, so you can view things through the lens of what's true for me and what's not true for me. So I think that sets us up to go into what we were talking about initially of like the basics. So what are your questions here?
Yeah, I think that actually sets me up to gush about you even more, because now everyone listening knows why I love you so much, which is like empowerment, education, knowledge, empowerment, and then being able to take that education and take that knowledge and say like, is this what's happening in my body? Is this normal? How do I feel? And then coming with really educated questions. Because that's true. Like, if you're only getting 15 or 20 minutes with your doctor, you should know how your hormones fluctuate throughout the month. Mm-hmm. You should know what's normal. Cervical mucus, tender breasts. Are these things normal? Is PMS normal? I think you do a really good job on social of really pulling back the layers and talking about what is normal and what's not normal. Because I think a lot of us accept a lot of these symptoms and side effects as normal. So take us back to sex ed. It's junior high. What do normal fluctuations in hormones look like throughout the month, and kind of what's the purpose?
Yeah. And so I want everyone, you may want to listen to this again. You may want to take notes. And if you're driving, you can't do that. Please don't do that. But, I also want to recognize that, only 17 states had medically accurate sex education at this time, and only 9 require it to be culturally and, gender appropriate, which means that what men are being taught, because they like separate the boys and the girls, which is always kind of weird, because it's like, if you've gone through puberty, you're like technically like a man, woman, and yet at the same time, society doesn't treat you that way. So if you're a teen right now and you're just like, you're super lame, that's okay. I will just own that straight out the gate. But I just want you to know that, because if you're like, I don't understand because this is what I see so much on social. I even have on the email newsletter. If you like my social and my email newsletters, I go even deeper, and people will respond and say like, I feel so stupid. I didn't know this. I'm like, why are you stupid for not knowing this? Like, I mean, I had this one woman, she's like, I'm an engineer. I feel so stupid. I don't know this. I'm like, I don't know anything about engineering.
Yeah. Yeah.
You didn't feel stupid, because really it was on your parents or sex ed to teach you, but what's the sex ed that your parents got? And there's also this generational, like, don't talk about this. And that's like, long ago, my patients were like, you're the doctor who talks about the things that like nobody talks about. I'm like, that's because we just have to start normalizing all of these conversations. We carry too much baggage of shame as women, because, even Instagram loves to shadow ban me when I talk about periods or vaginas, or perimenopause was the recent one. They were like, you're in timeout. We're not showing anything because you talked about perimenopause. And I'm like, these people,
how many people are going through that right now?
Right. But several people, notified me who work in tech, and they were like, see, periods are considered offensive by social media at times, and talking about this stuff is offensive because it offends men. And I'm like, my 7-year-old can build a anatomically correct uterus, cervix, fallopian tubes, and ovaries with Kinects. He's done it unprompted. He actually did it at like 5. And I'm like, it shouldn't be that way, because men want to know just as much about, how the female body works. And it'll also end their stupid jokes that aren't funny. Let's talk about the basics. So we're in sex ed, right? Number one thing that we need to talk about is, how does the menstrual cycle work? So we always start with day 1 being the first day that you have a flow. You see blood. It's not just spotting. So if it's less than a tablespoon, it's a tablespoon or less. That's not really a period yet. And it's okay to spot a little bit at the beginning and have like your period being like that. Sometimes I'm like, oh, your period just like did you a solid and it's like, hey girl, hey, I'm on my way. Like here's a little spotting. Get ready. Don't wear your white pants tomorrow. So the first day that you see blood, you have the flow, that's day 1 of your menstrual cycle. You want to track this. So everything I'm saying here, you want to track. Because when you go to your doctor, they should be asking things. When is your last menstrual period? Your LMP, that's going to be that date, that day 1. That's your last menstrual period. How many days did it last? So we want to count the number of days. And if you're like, I had 3 days of full force flow and then a couple of days of spotting, write that down and note it. So I have 3 days of heavy bleeding, and we can talk about like what's heavy, what's not heavy. And then, I have a couple days of spotting. So I technically have a 5-day period that's tapering off. Totally normal to have spotting at the end as well, where it's like this. So what's happening with your period? Your uterus is contracting and it's shedding the endometrial lining that's been building up. So, that muscle's working. And so sometimes people say like, your period should just be a flow continuously and just stop. And I'm like, no. When it comes to normal, there are variations. There is not like, we always talk about the 28-day cycle. Many people do not have. The vast majority do not have 28-day cycles. You might have I have a 25 to 27-day cycle. Normal. I have a 32 to 34-day cycle. Normal. As long as it's coming consistently and we can have a day or two where we're off, it's when it's like, sometimes I have a 30-day cycle. Sometimes I have a 45-day cycle. Sometimes I don't know when my period. That's when things are not normal. So day 1, we've got blood flow. We need to track the symptoms around that. So are you going to have PMS? This is the thing that drives me nuts when people are like, whenever I'm on oh, you're on your period and that's when you're most emotional. Actually, that's not when we're most emotional, but people will call that PMS. PMS is premenstrual syndrome. You'll see it as a diagnosis in your chart as premenstrual tension syndrome. That means it's before your period starts. And in fact, most people feel better when their period starts. So you'll be tired like the first day. And if you're like, I have cramps, like you're going to be like, I don't feel better. Yeah. Okay, there's the cramps. But emotionally speaking, most people are feeling better once their period gets going. And we can talk about why that is. But it's important to know that every joke that's like, a woman can't be president because if she was on her period, she would blow up the whole world. I'm like, that is so dumb. And you don't even understand physiology because no, it would be like 3 days before her period because you didn't stop talking and she asked you to stop and you didn't listen. Like, we'll talk about that. So we want to track what symptoms are going on. Are you getting acne? Do you have mood changes? Because you can have mood changes. It's just not the average time that we see that. Are you having bloating? Not totally. This is like usually expect bloating before that. And so your bloating should go away with your period because of the hormonal shift. Are you having diarrhea with your period? If you are, you're probably having really painful cramps because your prostaglandins are elevated. Shifting your diet with more magnesium and omega-3 fatty acids can help the cramps and the poops. So that's like a really easy fix. Not magnesium citrate though. Let me just tell everybody. Yeah. That will make you poop more. You want to do something like magnesium bisglycinate. So we use my magnesium plus in my clinic for that and my omega plus to help with the prostaglandins. So you want to be tracking everything that's going on. And we want to know your pain on a scale of some doctors use 1 to 5, some use 1 to 10. People hate this question because they're always like, that's so arbitrary. No, it's very, very specific to you. 10 is the worst pain of your life. So if you've already had a baby, you have your 10. If you've broken a bone, you have a 10. Like if you've fallen down, so whatever your 10 is of like that, I know to be extreme pain. And then does it impact your activities of daily living? All of this is really, really important because your doctor is not going to pay attention if you're like, oh, I have painful periods. Okay, who goes to the doctor? People who have problems, right? You got period problems, you go to your doctor. So your doctor's like, one, they might be like, it's normal. No, it's common. It's not normal. That's what your doctor's saying. It's common. It's not normal. And they might be like, here's a birth control pill. Well, wait a minute. Like, but what's going on here? So if you're vomiting, if you can't get out of bed, if you miss work, if you miss school, if you are just, if you just are like popping ibuprofen, Advil, like, and you're just like, I can't get ahead of this, that's problematic. You need to see a doctor. It could be a sign of endometriosis. And like most women's health conditions, endometriosis being one of them, It doesn't, women's pain, and there's plenty of research to support this, they're dismissed for their pain at a higher rate than men. They're expected that like, oh yeah, like you have babies, you should just be able to take pain, or you're being dramatic. Like it's in your head. You're just being dramatic. No, that's why you need to have this tracked. Okay. So nobody tells you that in sex ed. Track this data. It's important. But also when you can say, hey, I'm bleeding for 7 days straight and I'm having to wear a tampon and pad and I'm changing them every hour, that will get your doctor's attention. When you say, I vomit and I crawl to the bathroom, or I can't even leave the house and I'm missing, so sometimes it's like I'm missing 2 days of school every single month. That kind of quantifiable data will get your doctor to pause and listen, more so than being like, I think I have heavy periods. I think I have painful periods. So that's just the period. We haven't even talked about the hormones, but I just want to see if you have questions around that.
Yeah. I'd love for you to explain what endometriosis is for everyone listening.
Totally. So it used to be said that endometriosis was the endometrial lining tissue. It just implanted in other parts of the body. Well, what we've come to understand is it's endometrial-like, but it's not exactly the same. So it will respond to your estrogen the same way, but the tissue looks different. So under the microscope, it looks different. So you get these implantations. They can be on the uterus. They can also be, on your intestines. They can be in your lungs. So there are endo people who, when they menstruate, they'll actually cough up blood because they have endometrial tissue. That's super scary, by the way, when that happens. And so this is incredibly painful for some people because when you bleed in places that there's not supposed to be blood, you're going to have inflammation, immune system activation. And so it can be painful. You can get adhesions because your body's like, I'm trying to heal this. We've got all these problems. It can lead to infertility. The younger you're put on birth control for pain and the longer you stay on it, the more likely you're going to be diagnosed with endometriosis. This is why I believe that giving the pill or the patch or any other form of contraceptive for symptoms without asking why is a major disservice, because you're punting the ball with endo, with PCOS and this thyroid disease. And then women find out decades later that they're actually infertile because the disease was allowed to progress without having that care. So that's endometriosis. It's looking more and more like it's autoimmune in origin. So that comes down to like, what's up with your gut health? What's up with your genetics? And no, it's not something where you just have to be like, oh, this is my lot in life and I just have to take it. There are lots of interventions from, completely natural, doing diet and lifestyle, bringing on supplements, to excision surgery. And honestly, most people do well to do a combination of things. So they may be using birth control and doing a dietary approach and then meeting with an excision surgeon so that they have that relationship should they ever need it in the future. That's really important, especially with mental health. If you think you're going to need a specialist of some kind, shop around before you absolutely need them. Because when you don't want to find yourself where you're just like, oh my God, I'm just going to go with this person. You're not going to be satisfied with that.
Right. So just to recap, our endometrial lining is obviously the blood lining inside of our uterus that is shed during menstruation. And endometriosis is when tissue like our endometrial lining is found in other places. It responds to estrogen in the same way and bleeds, causing a cascade of issues.
Yes.
Perfect. Okay, cool. Let's go into hormones. Tell me everything.
One of your period, that's when your hormones are going to be at their lowest, specifically estrogen and progesterone. They have to drop to signal the uterine lining to shed. So, but here's the thing. People like to say there's the menstrual phase and then after that's the follicular phase. Medically speaking, that's inaccurate, but I'm going to break it down so you understand that you're not a bad person or wrong for saying these things. So the follicular phase, that's days. So we're going to do a 28-day cycle. For you, it might be different. That's days 1 through 14-ish. Then we get to the ovulatory cycle. So let's just say that's like day 14. That's a 1-day event. And then we move into the luteal phase, which is roughly about the 2 weeks following ovulation. Now, why in medicine we have the follicular phase as one chunk is because the entire goal of the follicular phase is to get ready for ovulation. Your ovaries don't care what your uterus is doing. So the menstrual phase only applies to the uterus. It doesn't apply to the ovaries and the brain, because the ovaries are like, whatever, you clean house because I'm getting ready for the next egg. So by day 3 of your period, you're going to have already your estrogen rising, and your follicle stimulating hormone is rising as well. That's stimulating the follicles in the ovaries to get ready. The follicles, basically the follicles are all racing to be like, who's going to be the winner here? And then one winner. If you're odd, you can be the outlier, totally like odd outlier that has 2 eggs released in a month. That's not as common. 2 eggs released at one time, rare. Ovulating twice in 1 month, super rare. Okay. I want to acknowledge because people, especially on TikTok, people are always like, that you could do that. I'm like, in theory, but like, that's so rare. Okay. It's more rare than twins for what we know. So yeah. FSH, brain. So all this is taking place in your brain, everyone. So your ovaries, how they know what to do is because of your brain. So your brain says, follicle stimulating hormone, let's get ready for a baby. Now, what you're going to find during the follicular phase, estrogen is rising. It's super important. It's helping that endometrial lining proliferate, get ready, like nice, cozy, like, bed to cuddle up in if you do have implantation, like that, if you do have a fertilized egg. And testosterone is going to start rising. So if you notice like before ovulation or like, I don't know, around like day 10 of your cycle, you start getting acne, look at your testosterone. It's probably testosterone, and it can be an estrogen component as well. But what you'll notice is you're getting the mood. So now you're like, my libido's up, my energy is up. I feel like my boundaries, like you want to set boundaries with people, now is the time. You're also going to be like, what is Dr. Brighten talking about? That she's like, people need to get like really high quality sleep and like, not skip meals. I'm like skipping meals and sleeping like 5 hours right now. I'm fine. Yeah. Like you can get away with that. Well, please don't, but you can get away with it. And so the testosterone rising is really about you getting in the mood so that you engage in sexual activity where semen is introduced to the vagina, and it can be stored there for about 5 days. So about 5, maybe 6 days. So this is why we talk about a fertile window being about 6 days, is because if you have sex on day 10 and then you ovulate on day 13, you could end up pregnant. And I hear from women who are like, I don't understand. I didn't have sex the day I was ovulating. I'm like, let those sperm be tricky, y'all. So understand that. And if you're like really in the mood and then you're seeing like egg white, if you've got like, you're like, this is like raw egg whites in my underwear, you're going to be
ovulated.
Yeah. So we're going to have what happens right before ovulation. Estrogen is going to spike. Sometimes you can get headaches in this time if your estrogen's overkill. But estrogen will spike. That signals the brain to release luteinizing hormone, or LH. That tells the ovaries it's go time. And so basically the ovaries drop the egg and it's got to make its way down the fallopian tube. If it's fertilized, it's going to implant. If not, it's gone. It's gone. I mean, it really, some sources say 12 hours is max it lives. Some say 24. There's some that are like, it might live 36 hours. I'm like, yeah, I don't know about that. That's kind of pushing it. So everyone who's trying not to get pregnant usually hears like, you can get pregnant any time of the month. This is not medically accurate sex ed. You can get pregnant any time of the month, so you can just like never have sex, just abstain. Look, if you want to do abstinence, totally your call. But scientifically, that is not accurate to saying you can get pregnant any time of the month. It is only once we struggle to get pregnant, is only once it's been like 6 months of trying and not getting there, that your doctor's like, oh, well, did you know that like you can do an LH test strip and then you have sex that day, and like there's this egg and there's this window, and then that's when you get pregnant? And women are like, why have I been having sex every other day? Like, I mean, that could be a good time. It might be a good time, but like, and feeling like I'm just doing it wrong and my body's broken, when it's like, no, there's this window. Like that's your time. Like that's like, you got to get it in at that point, or after that it's done. Now, why do we want to all ovulate? Because what's left in the ovary is something called the corpus luteum. So you ovulate, corpus luteum then secretes progesterone. So we've had estrogen, we've had testosterone. They stick around the rest of the cycle, but now progesterone comes on following ovulation. And in your luteal phase, so this is leading up to your period, you should feel chilled out, calm, sleep really well. You should be like, oh, love my life. Like, I don't know why. I just like love my partner. I just love my children. I just love my community. But like, why do we not feel that way? Because we can have issues with stress, and we can get into that deeper, impacting that progesterone. And so progesterone is going to be your main diva. She's going to take you through that luteal phase. If there's no fertilized egg, there will be no HCG. That's what you pee on a stick and you detect for pregnancy is HCG. No HCG and no signal to the brain. It says drop those hormones. So the corpus luteum involutes. There's no pee in there, guys.
Yeah.
And then the uterine lining sheds, and then you start over again. So that's your menstrual cycle, and that's everything that's going on there.
I think what's so interesting is the side effects that happen with an increase or I guess too much of something. Like you were talking about acne and having too much testosterone and, progesterone being a diva. Can we get into some of those imbalances and how, obviously if testosterone's up and you get acne, you're like, oh my, now that I listen to Dr. Brighten, I know that may be because I have too much testosterone or I have a high dose of testosterone. What are the most common imbalances you're seeing in the women in your practice? How do you identify them and how do we fix them?
Yeah, so most common, so cortisol dysregulation, we'll say, so sometimes it's high, sometimes it's low. Either way, it's just an HPA dysregulation. So brain is talking to the adrenal glands. Sometimes they're acting like a toddler, they're not listening. Other times they're like the child that like super A-type really wants to please you, going overboard. So we can see that. We see a lot of low thyroid, very, very common, especially when we get into our 30s. Starts to become like 5 to 8 times more likely that you're going to develop hypothyroidism. And then we see low progesterone, high estrogen. Those two tend to go together. When we see high testosterone, you can have low testosterone, usually links back into those adrenal glands, but when we have high testosterone, we start to think about polycystic ovarian syndrome. It can also happen with coming off of birth control, where we get an androgen rebound going on. It can also be due to inflammation issues going on that are driving the adrenal glands. The tricky thing about that is that the adrenal glands can kick out DHEA. You can have high testosterone, but then with inflammation, if aromatase, an enzyme, gets upregulated, then it starts pushing it all into estrogen, and it can get really confusing. And that's why in Beyond the Pill, my book, I put a quiz in there so you can go through your symptoms. And what a lot of people say is like, why am I experiencing, like, it says I have high and low cortisol. Yep. You know why? Because you have low cortisol in the day when it should be optimal, like be high. And then it's flipped at night, it's going up. And then they'll say, but I don't understand. Like I am having issues with like low progesterone and high estrogen. I'm like, yep, those love to hang out together. And so it's very rare. I don't think I've ever, I'm trying to like think, because I'm always cautious about absolutes, but I don't think ever in my career I've ever seen just one hormone be out of balance. And that's because it's like a symphony. Right? And if one is out of tune, the entire symphony starts to shift and it just gets cringy. You're like, oh, what's happening here? And it's because they really have to be harmonized and all working together. And you can't have, for example, if your thyroid starts getting low, your adrenal glands are going to be like, I'm going to try to compensate. Like, I'm going to try to help and I'm going to come in. And then as thyroid gets low, your receptors aren't using progesterone as much. Now estrogen, I think about like estrogen and progesterone as like divas in a way. And it's like, estrogen can be like your Beyonce. I'm like, dude, if Beyonce takes the stage, like, who are you going to bring on? Who are you going to bring on that's going to knock Beyonce off the stage, right? You got to bring like Aretha Franklin or something. I don't even know. I'm not that cool. I should have like cooler analogies. But you have to, like, progesterone is like equally her own diva. And so if she comes onto the stage, like, they can share the stage and not rival, and it can be just awesome. But if you've got if you don't have that progesterone diva coming on and you've just got Beyonce on the stage, like that's the headliner. Nobody cares about the ancillary side bands. Like nobody even wants to see them. And like those hormones can't come in and counter what's going on with estrogen.
Got it. So let's go back to high testosterone, and you dropped polycystic ovarian syndrome, which I just want everyone to know because is PCOS. You hear people talk about PCOS all the time. I want you to take it back to the reasons that you're seeing people have high testosterone based off of their adrenals. Because I think you hit the nail on the head when you were going through the cycle and you said, yeah, and for all those people who are skipping meals and sleeping 5 hours and saying they feel great, like how are lifestyle choices affecting our adrenals and cascading to our sex hormones?
So, as you guys will see this on Instagram, you'll see on my website, you'll also see it in my book, and I talk about this pyramid. I talk about how the foundation of your hormonal health is your adrenal glands and your insulin. Now, we all have to take care of our adrenals now. Like, God, I wish someone would have told me this at like 16, because they become everything when your ovaries quit. Adrenals don't quit. Ovaries quit, and then the adrenal glands have to come in and take over to carry you through life. So, and when I say quit, I'm talking about menopause.
Right.
So, not talking about like, if you are like 30, they should not be quitting. So with that, that's really the foundation of your hormonal health. So if we've got copious amounts of stress going on, inflammation, hidden infections, anything impacting those adrenal glands, we're going to see problems higher up. And, I put insulin in that because they love to interplay with each other as well. So right above that is your thyroid. And so your thyroid gland is going to be impacted by that foundation. And in fact, that foundation, that may be the first hormone that you see get off is thyroid hormone. And at the very tippy top of that pyramid, it's going to be your sex hormones, estrogen, progesterone, testosterone. Those are the ones that, like, even if they're slightly off, they start to drive us nuts. Because like even a little bit of acne or even a little bit of moodiness or feeling bloated, with thyroid being off, like you can kind of compensate. Like you're like, my energy's low. I'm going to like drink more coffee. And you like start to compensate until you can't compensate. So we always want to start at the top. And yet what we really need to start at is that foundation. And so go through this in a lot of places and it's never sexy. It's always like the stuff your mom told you to do. And it's like really obvious. And yet none of us do it very well. And as I go into this, I also want to recognize that one, we've got a severe evolutionary mismatch happening in which your body's not quite evolved to be walking around with a cell phone in your hand and viewing like hater comments all day or the light that's emitted from it or the news and all of that can be stressful. But also we're not supposed to be experiencing light 24/7. And yet because of street lamps and all these things, and that might seem like, well, that's keeping me safe. It serves a purpose. Yes. And you need to get yourself some blackout curtains because that's a stressor to your body. It's not getting that complete darkness to get in that circadian rhythm, so that dark light cycle. So the other thing I want to acknowledge is that, there certainly is food privilege and there's different privileges that can affect this, and also allostatic load and generational trauma. So it's really important to recognize that if you have a history of trauma, so in your lineage, if you have a history of trauma, if you personally have a history of trauma, this can impact how your adrenals respond to stressors. So like 2020, like I was just saying to my husband last night about 2020, like something that like just happened last week feels like that was so last year or even like last decade. And yet it's just like been bombarding with stress, right? And some people are just like, oh, that wasn't that big of a deal. And some people are like, well, a lot of people, right? Because 1 in 3 have anxiety now. Like we're seeing way more anxiety. But some people's entire nervous system and hormonal system are primed for the stress response. And so the littler things can impact them more. And so I just want to acknowledge that because so often we'll talk about things about like, we need to eat regular meals. We don't want to be skipping meals. Yes, intermittent fasting does have some efficacy in the research, but it might not be true for you that that's the best thing for you to be doing. If you are hungry and angry and you feel shaky after you intermittent fast, it's not working for you. Like maybe later, try another time, but you need to heal your hormones first. It's too much, especially if you have ovaries, you are in tune with your environment. If you want your hormones to be balanced, you have to send the signal that the environment is safe. So that means eating those regular meals, not starving yourself, so to speak. And that definitely happens. And that was kind of a frank way of saying it, but straight up, like if you're on 800 calories, and I will say, There are doctors out there, and this pisses me all kinds of off, where doctors are like, your problem is you just need to lose weight. It's like the answer for everything. Like, oh, you have ovaries. You just need to lose weight and stress less. And then they're putting people on 800 calorie diets and telling them to go do an hour of cardio. And I'm like, do you hate them? Do you hate? Because like you're literally killing like their endocrine system right now, because our body wants to know the environment is plentiful and safe so that we ovulate. And it's, like, whether or not you want to have a baby, your body's like, just tell me I could. Just tell me it's possible.
Yeah.
So again, it's those regular meals. It's, stress practices. So if you are someone with a history of trauma, you have to be on your game for stress reduction practices. Does that mean you need to like go to yoga for every day and meditate for an hour? No. You need to figure out whatever works for you. You might journal. You might color. You might be someone who goes for a run. You might be someone who punches and kicks things. And there will be people out there who are like, you really shouldn't be aggressive. Like, who cares? You do what you got to do to move that stress out of your body. If you see a gazelle run from a lion, like out in the plains, like what does that gazelle do afterwards? It shakes and it shivers and it gets back to its community. That's what it does. And nobody's out there being like, you really shouldn't shiver like that. Like, that's like weird. And you're making people uncomfortable and like, oh, like don't talk about that. No, everybody's like, do what you got to do. Like, that was scary.
Right.
You understand it. So understanding that whatever your stress reduction practices look like, they need to be something you cultivate on a daily basis. Let 2020 be your greatest teacher of, you don't know what's coming tomorrow. So tend to yourself now and really fill up that bucket. And then we talked about the sleep. We need to be going to bed at a reasonable hour. We all have different cycles. Some of us are more night owls. Some of us are more nightingales where we get up earlier. You need to honor what's best for you, but make sure you're getting restful sleep. So I love tracking my data and seeing where my sleep is, but how you wake, if you don't wake feeling rested, you're not getting restful sleep. Who cares if you spend 10 hours in bed? You're not getting restful sleep. So we need to work on that component as well. And sometimes, in my practice, so we'll use my adrenal calm formula that has phosphatidylserine in it. So everyone, this amino acid that helps bring down cortisol in the evening the way it should. So it's working with your body naturally, but also parasympathetic nerves. So herbs that nourish the parasympathetic nervous system to basically get you in that rest and digest state. So things like passion flower can be helpful, California poppy, valerian root, these kinds of things that you can do a bath, you could do reading, you can do whatever you want to be doing is like your stress reduction practices in the evening to wind down. And then bringing on something like that can work with that, especially if you're someone who's like, I feel wired at night, but I'm so tired. That's a point that people often miss intending for their adrenals. Like they always want more energy in the day. Like take my B vitamins in the morning, take my rhodiola in the morning, like go. But really, if you can be using things, to get that restorative, restful sleep, you're actually healing your hormones at night. Your melatonin will rise and oppose your cortisol. And that melatonin, super protective for your brain. It's an antioxidant. It protects your ovaries as well. And it's going to combat those cortisol levels. So does that all make sense?
Yeah, it makes perfect sense. I love that you're using things like valerian root and phosphatidylserine to support that cortisol curve and allow for melatonin to come up so that cortisol drops. Because I don't think people really realize that if your cortisol is high at night and you're in all this light and you're not producing melatonin, of course you're not going to be sleepy. That's when you're going to be like, let's do this.
Yeah.
And it's a really hard train to get off of for a lot of people. And they just assume that like, this is my body and I'm fine. Mm-hmm. Instead of actually knowing what it feels like to get in bed before midnight and get 7 to 8 like hours of sleep, not from 1 a.m. to 9 a.m. You know? So,
and we're adaptive organisms and we will compensate. So why I say that is that sometimes you forget how good it feels to feel good. And I see this a lot with patients. I have them track their data and like we track their starting place and then take them through, the whole, we go through our protocols, work with them. And oftentimes they'll come in and they'll forget they ever felt bad. They'll be like, I never had problems with that. And they're like, oh my God, I did. That's right. And so, remembering that. And then other times people won't remember when's the last time they even felt good. Like they could even get out of bed and they just forgot that like there ever was a time. Like, we will adapt in that way. I think it's for our mental health that our body's like, okay, we're just going to keep moving. Like our brain's like, keep moving, keep moving. To your point with light, if you get up at night to use the bathroom or with a child, don't turn on your lights. So we actually, in my house, we wear amber glasses. As soon as the sun goes down, we wear amber glasses. We still have lights in our house. I got a lot of stairs in my house. I still got some people are like, turn off all your lights. If you can, I like to go by candlelight if we can, like one day out of the week, just to like try to retrain all of that. But this happens a lot with new moms who are getting up with the baby, turning on the light. By the way, your baby's going to wake up too. It's going to spike their cortisol. That light goes through your eye, hits the pineal gland. The pineal gland says, break down melatonin, bring on the cortisol. So this is what's supposed to happen first thing when you wake up. So first thing when you wake up in the morning, expose yourself to natural light. You don't have to see the sun. Okay. It's there. You just have to expose yourself to natural light and that whole hormonal process will begin. But this is something that it's like, look, being a mom is hard. There's a lot of reasons why your adrenals just like feel like they're just like, you hate me. Like, why do you hate me? And yet that night waking and turning on the light, wear a red headlamp if you need to go to the bathroom at night instead, like grab that and use, and you don't have to wear it, but you can walk around with it too. Or have like a pink Himalayan salt lamp that you turn on and that will buffer the light as well. Yeah. We have that in our house.
I have those little night lights, those pink Himalayan salt
I
night
know,
lights.
they're so cute.
They're so cute too.
Yeah. So things like that, it can make a huge difference. And so, initially I find that my patients do often need supplement support. It's like, we need to get the routine established and supplement support because we've got to get this moving along faster to get that better sleep, but also so it reinforces the behavior. Because if you're doing a behavior and you're not seeing changes, then we're all impatient, right? So that's like totally fine if you're impatient. I am that too. But if you're not seeing improvement, like you're going to fall off that behavior train like a little bit quicker. So, and then you may not need them again in the future, but I just want to be clear that you can't out supplement a poor diet and lifestyle. So, and like, listen, I have my own supplement line and I'm going to tell you, you can't just go take my adrenal, supplements. You can't just go take my thyroid supplements or my balanced women's hormone support supplement and think like that's the fix. That's all I need. If you are also skipping meals or you don't eat any vegetables or you never move your body or you're like, in not setting your boundaries, you're in super toxic relationships, allowing people to treat you like trash. Like you can't just take a supplement and think, oh, that's going to go away. The supplement can help you, but it's really more like rocket fuel. If you can build the rocket ship, then the rocket fuel will take you where you want to go.
I love that analogy. That's so good because it really is like the controllable, what you were saying about people having a lineage of trauma and having maybe an overreaction to a stressful situation. It's like you can start to work through that. That's going to be a longer process, but like what can we control? We can control what time we go to sleep. We can control the fact that we're opening our windows first thing in the morning. We can take a supplement to support ourselves and we can look at the lifestyle factors that are in our control. Maybe not like the childhood we grew up in or, the toxic ex that we had or whatever it may be. So I love that. I love the reality that you bring to changing hormones and the fact that people do want a quick fix. Like that's really tough too, because a lot of times
we're trained for it. Every commercial tells us we can have it. And you'll even see people out there that'll be like, you can change like all of your hormones in like 7 days and like your entire menstrual cycle will be changed. And I'm like, not really. Like, and you have to recognize that like your menstrual cycle is going to be roughly a month. So it's going to be taking a month of, initiating change for you to realize like what's going on. It can also be a situation where you have a major stressor and then 2 months later, you have the worst period of your life. Or that like, you're doing great. You're doing all this stuff. And 3 months later, you're like, oh my God, like I didn't even notice my period was coming and like I feel phenomenal. And you forget to congratulate yourself because you're like, oh, it's been all this work I've been doing this whole time.
Right. And I feel like the times that people really want period support or really start to care about their menstrual cycle instead of just pushing through the way that like society tells them to with all of these symptoms that may not be normal is they haven't had a period or they're trying to get pregnant.
Yeah.
And they're thinking about, oh, I haven't had a period. I'd love to know that I'm fertile. And like, does this mean that I'm not fertile? What's wrong with me?
Yeah.
So I think I would love to, if you don't mind, I'd love to go through your recommendations for bringing back a period and what like what you see are the main culprits, and then any fertility support that you think is important for people to understand. And then I'd like to also go back to that point on insulin, because I'm a huge blood sugar geek.
Yeah.
I'm all about blood sugar balance and like creating a life that makes that really easy. So that means keeping insulin under control. So maybe we can unpack those three things. I would literally talk to you for hours.
Yeah. Okay. So you just asked me a lot there. So if I get going and I forget something, you just remind me.
I got it. So, I got my mini list.
Let's talk. So insulin, if you're having insulin dysregulation, we're going to see issues throughout the body. And so, especially if insulin's not able to dock onto the receptors because maybe we have inflammation going on, other hormones are going to have problems docking on the receptors. Insulin can be especially problematic in PCOS. And that's when we can see increased androgens coming because of how things are getting stimulated in the ovaries, and the ovaries perform differently. The theca cells start producing more androgens. So high androgens can actually cause you to lose your period, and it can become a big fertility problem. So with that, that's why polycystic ovarian syndrome is associated with infertility. It's not that if you have PCOS, you will be infertile. I hear lots of doctors, I see them on social media saying that. You have PCOS, so you're infertile. And I'm like, stop it.
So many clients that have gotten pregnant and they have PCOS. And I'm like,
yeah, or they get told that. They get told, one patient that she's like, yeah, and unplanned pregnancy, because my doctor was like, oh, you have PCOS, you can't get pregnant. So like, you're just not going to get pregnant unless you get like IVF. And she's like, and then I got pregnant because I stopped using. I was like, well, if I can't get pregnant, I'm not going to use protection. I'm like, oh, see, like you got to stop with the misinformation there. So with PCOS, you can lose your period for that reason. If you do not ovulate, you don't get that progesterone cascade, and then you don't get the drop of hormones, which then leads to a period. So your period can go missing. And with that, it can lead to endometrial hyperplasia, which is overgrowth of the endometrial lining. And if that goes on for a long time, then that could become endometrial cancer. Now, I just want to be clear with this because often women are told we have to get on the pill. It's the only way to protect you from endometrial cancer. No, I am like so over like, this is the only way. No, this is one way, and it may or may not be right for you. By the way, that's like, it's technically unethical and illegal to say like, this is the only treatment when that's not true. You have to give a true informed consent, which is to say, this is one treatment. This is why we would consider it. Here's the alternatives. And the alternatives are, we could use progesterone to try to stimulate a period, or we could, actually work on optimizing your blood sugar and getting your inflammation down, and, bringing on other therapies. Lots of women with PCOS are able to cycle naturally and not actually have to use any pharmaceuticals. And some will use something like metformin and bring that into play, and they get pregnant. And like, whatever is best for you. I'm not, people always get really confused because they're like, are you anti-birth control? Are you pro-birth control? I'm like, I'm pro you having access to birth control. I'm pro you having information and you making your own decision. I'm not going to make that decision for you. And I like the buffet of medical options. I like to have all the medical options and be like, okay, we're going to do a little bit of this, a little bit of that, because that's what works for you. No, two patients are going to get the exact same treatment plan in my office just because like that's the easier route to go. So with losing your period, so PCOS should be ruled out. With PCOS, it's called polycystic ovarian syndrome. The odds of you having polycystic ovaries is low. The older you get, even lower. So, really what we're going to see is we're going to see those high androgens, and we're going to see an ovulatory cycle. So you don't ovulate, or it's like hit or miss. And so you have those irregular periods. So that's one thing that needs to be ruled out. If your period's gone missing, the very first thing is if you've had a regular period, you need to check if you're pregnant. So if you are having sex with a male partner, you need to check if you're pregnant. Even if you're like, it's not possible. Even if you're on the pill. Even if you have an IUD, get it checked, okay? Because like I always am like, this is where Jeff Goldblum comes in and he's like, life finds a way. Because it does, okay? And there is no 100% form of birth control except for just not having sex, okay? And that's not realistic for a lot of people because that's just that your hormones say otherwise. Okay? You want to do a pregnancy test. The other thing is that we want to start ruling out other issues. So prolactin is one that we want to check. Prolactin is the hormone associated with lactation. That keeps things suppressed postpartum. Your hormones suppressed so that you don't start cycling, so that you can enjoy oxytocin. So you might be like, no, but I want my hormones back. I hear this all the time. Women are like, oh, how do I get my period back as soon as possible postpartum? I'm like, enjoy oxytocin. It's epic. It is like, it opposes cortisol, and it's like, see all these cells you've been trying to age cortisol? Yeah, I'm gonna roll back time on them. I am anti-aging queen. Plus you are just loving everything. It is seriously, I remember breastfeeding is like, in the beginning, it sucks so bad. It hurts so bad. Or maybe that's just me. No, I know it's not.
No, everyone has their struggles.
Like, as soon as the oxytocin would hit, I'd feel it and I'd just be like, oh, I just like melt. And I'm like, this is seriously, we do prescribe this. We can sell this. Oxytocin is the one thing I could find myself addicted to in life. But I'm like, don't be messing with your hormones. Don't be messing with your hormones, people.
Right.
So with that, that can also happen if you have a prolactinoma, which is a benign brain tumor. So what your doctor would want to do is, if you don't have a period, we're not going to test progesterone. It ain't there. Like, why waste your time on it? But we are going to test, typically I test FSH and LH because I just want to see what's going on with the brain. How's the brain communicating the ovaries? And I will test estrogen to see, like, are you making estrogen and what's going on here? Because I want to be aware of that, and metabolites, just so that we don't end up, if you have unopposed estrogen, that's when the big scary things start to set in if it goes on too long. So I want to be aware of where we're at with those things. And then, sorry.
What are the androgens you're looking for PCOS?
Testosterone, DHEA. So free testosterone is best for women. I like to do free, total, and with a sex hormone binding globulin to see, are you gobbling it up and trying to keep it in check? And then DHEA is another one that I'll look at. That's like the starting place of where I'll look with those. And then sometimes I'll also do like DHT because that's a potent androgen. Testosterone goes to DHT. We lose our hair on our head and we grow it on our chin. It's fun times.
Oh my gosh.
It can also lead to acne as well. It's not a terrible hormone. It's just when it's out of check. So those are the androgens. I'm going to take a drink here real quick.
Yeah. Take a minute. I love it. I love that. I mean, it's to me like a geometry proof. You're just getting in there to be like, how does this add up? And how does 1 + 1 = 2?
Yeah.
And if there's something off, it's really a functional approach to female hormones so that you have like a greater understanding and ruling out these things like potential benign brain tumors, polycystic ovarian syndrome. I think most people think when they have PCOS that they are going to have cysts. Mm-hmm. But you can fully have PCOS without the presence of cysts.
Yeah.
Okay.
And, another thing, so one thing I want to say to everyone before I talk about the next issue that could cause a missing period is that you need to track your symptoms, and your provider needs to interpret your labs in the context of your symptoms. Because if all they're doing is looking at reference ranges, they might be like normal. Optimal is not normal. Okay. Optimal is not the same as normal. And so you might be within a reference range, and I have seen this, like vitamin D is one, and they'll be like, well, you're like 1 point within the reference range. And I'm like, yeah. And it's September and they live in the Pacific Northwest. So give them a couple months. Where are they going to be? They're going to be deficient. So let's actually do some real preventative medicine here and get some vitamin D in that system. So, I mean, vitamin D can mess with your hormones too, guys. So vitamin D deficiency can be an issue, but you have to be looking at your symptoms, because if your doctor's like, oh, well, your testosterone looks normal, and you're like, but I have all this cystic acne and I'm not having periods and I have chin hair and chest hair and I'm starting to have thinning hair, look at that testosterone again and tell me it's normal. Or maybe you didn't run the right test and you need to go a little bit deeper with that. So the other thing that should be checked that's super common is thyroid disease. So hypothyroidism, most common. Graves' disease, rare, but not uncommon. You can definitely see it, but you're going to see more hypothyroidism, which is generally due to Hashimoto's, which is an autoimmune condition. So with that, your menstrual cycle is very much tied in to your thyroid function. If you have elevated prolactin levels, you want to look at your thyroid, because sometimes it's a prolactinoma and sometimes it's that the same mechanism that's telling the brain, so the brain saying make thyroid hormone via TSH is also causing prolactin to rise. If you have PCOS, there is no reason why you can't have PCOS, do everything right, but also have hypothyroidism, and just taking thyroid medication restores your period. Like, Sometimes some providers think that like you have one disease, one condition, that's all we're going to look at. And they forget that like, no, there's like always the sidecar buddy that can ride along. Like this, like that can be there. So looking at thyroid disease, and that's why it's really, I have seen way too many patients who have been given the pill for their missing period. And then to find out that they have hypothyroidism. And they were like, yeah, I was dropping out of college because I was too tired. I couldn't get out of bed. The brain fog was so bad. I was an A student. Now I can't even pass. I got kicked out. I was gaining weight. Like they start going through all these things. And I'm like, you needed thyroid meds, not birth control. Birth control does not fix your thyroid. And it's a simple blood test. I could have it back in like a couple of days and have the answer for you. And you get your whole life back. As someone who has hypothyroidism and went through all of that, oh my God, I'm like, that we just leave women to struggle and just are like, well, birth control fixed your period, so it's done. Well, no, but it didn't fix my period because that is a medication-induced withdrawal bleed that's like optional. It's not actually even a period. So definitely check your thyroid in all of that. And then there's hypothalamic amenorrhea. So we've got to rule everything else first. Okay. Rule it all out. Do all the testing. You will find, I have information at drbrighten.com about period, test for a missing period and go through all of that. If we've ruled everything out, there's nothing organic causing it. That's when we'll make the diagnosis of functional hypothalamic amenorrhea, often just called HA or hypothalamic amenorrhea. That's generally two. We are over-exercising and under-eating. And so that is something I have, my God, like seriously, don't put me in the room with the male coaches. Okay. I'm just like, don't even let men coach women anymore in sports because like the soccer team uses their menstrual cycle to train and their coach is like, we're going to like work with your hormones and your period. And like, we're going to get it so dialed in, freaking win all the cups, go all the way. I'm like, oh, look at that. Look at that. Where before that, coaches were like, just get on the pill so that we don't have to deal with your period at all. I'm like, that's stupid. It gobbles up testosterone. Now her muscle mass is going to be impacted. Like, what is wrong with you? Like, plus, like, I mean, we could do a whole podcast on like exercising and like what you can do with your menstrual cycle, but we don't give the pill for hypothalamic amenorrhea. The Endocrine Society says it's a no-no. The reason why they advise against it is you will never know if you increase caloric intake or you dial back on exercise, if you spontaneously get your period back. We'll never know. So they're like, okay, look, if you've got to do it for birth control, it's a different story, but it's not okay as a first line treatment. And it doesn't protect your bones the way we've been led to believe all this time. Your natural estrogen does. So, and why I'm like, you guys, I'm just kidding about the male coaches. But one thing is that a lot of male coaches will be like, it's fine to lose your period, just get on the pill. Or they'll be like, oh no, that's a good sign. That means you're like cutting, you're making your weight and all this stuff. No, your period is your fifth vital sign. If it goes away, I'm as concerned about that as if you have hypertension. I'm like, yo, what is going on? Like we have to figure this out because something is wrong. You have a stressful event take place and you lose your period 1 month. We are not worried about that. It goes away for 3 months. You need to get worked up for that. So with hypothalamic amenorrhea, we have to look at stressors. Oftentimes we reduce it to like, you just need to eat more and you need to exercise less because that's the vast majority. But I do want to say, if you've had a significant trauma, so especially something like sexual trauma, loss of a loved one, something like that, that may impact your period. It may be enough stress to shut down your period. And especially on like, how are you coping? What's your social support looking like? And that's like not as common as what we see, but we do need to talk about that because you might be like, I'm a healthy body weight. I am actually not exercising because I don't even want to get out of bed. And I'm binge eating everything because that's my coping skill right now. And still your body is like, we're just going to crank cortisol and we're going to just shut down ovulation. And so, and you'll hear some doctors say, oh, that's not possible, except that like, what's your demographic you're working with? Because if you are working with a demographic that has, so if you're working with members of the BIPOC community, if you're working with somebody who is an immigrant, has escaped war, like these different things, like why wouldn't your period shut down during wartime and like things like that, right? When it's incredibly stressful, like it depends, right? And this again comes back to you have to signal to your body that the environment is safe.
Yeah. And under eating is like, if you're not able to keep your body nourished, then how are you going to nourish a growing human in your body? And if you're overworking out, that can automatically cause a major release of cortisol. Yeah. And then all the other traumas that you're talking about. I love that. I love creating a safe environment. I love, and as women, we tend to be overachievers. We tend to think we can handle it all and do it all and add it to our plate and go to the extremes. And then our fertility takes a hit. For sure.
Yeah. And, with what you're saying, okay, if you're not eating enough, you're like, I'm trying to go lose weight. Your body's like famine. You're over exercising. You're like, I want to be fit. I want, whatever your goals are. Like your body's like, there's lions and tigers everywhere. Like we are always on the run. It is like terrifying. You've got a job you hate and your boss is always yelling at you. And then you feel like panic and freaked out. Your body's like, there is a predator. There is a predator threatening us. Like that's the evolutionary mismatch I'm talking about. Like the modern human way of living, your body's not caught up yet. Your body's like, look, like what is all of this like that's going on? So, and we talked a little bit about fertility. I don't feel like I answered your fertility question though.
No, I'd like to go a little bit deeper. I mean, I think we're sort of touching on it with creating safety and making sure that we do have a functioning period and that it's not just 1 month where we're taking off of having a period because of an event, but like really making sure that that is as consistent as it can be. And obviously that we're ovulating because you can't really have a baby without ovulation. So let's jump a little bit into fertility because I know this is, as someone who so I've had 2 pregnancies. I'm on my 3rd pregnancy. My first pregnancy was a miscarriage before Sebastian. Then I had my son Sebastian, and now I'm pregnant again and due right around like Thanksgiving, the first week of December.
Oh my God, it's right around the corner.
I know, seriously. I'm like, let's do this. Let's talk about like sex, ovulation, fertility, female hormones. So I'm like so pumped up to talk about this stuff right now. And also I launched a pregnancy course about nutrition and blood sugar balance. Just like tools for that. Because I've been so excited about this time and just being realistic with people.
Yeah. Well, and I don't know how old you are, but the older we get, I'm getting there. The more we're scared about like, gestational diabetes, you're just going to get gestational diabetes. Like, because statistically, there's a lot of people with gestational diabetes. Statistically, there's a lot of people with diabetes and they've got some things in common. Like there are genetic components, but it's something that I love that you did the course because there's so much in your control. When I was pregnant with my son and they were like, we have to screen for gestational diabetes. And we're like so concerned. I was like, I'm not concerned. Like, what's the treatment? And they're like, you're going to eat like protein, veggies, not eat a bunch of carbs. I'm like, that's how I already eat because that's how I feel good. But I'm not saying, I don't want anyone to hear me and be like, don't eat carbs in pregnant. That's not what I'm saying. What I'm saying is like, I'm not someone that can sit down and eat a bowl of white rice and feel okay afterwards. I'm like, no, I'm not happy. Like I'm hungry.
No, I think that it's like, well, that's the myth and the mistake that people make right there is like that this minimum requirement of carbohydrates when pregnant is a complete, like, it's just a complete disservice leading to gestational diabetes. And people are looking going like, I should be having 150 to 175 grams of carbohydrates a day. And a lot of people that I work with are somewhere between, depending, not keto people, but sometimes depending who they are, between like 50 net and 100 net, maybe a day. And so to sit down and be like, just double that up and you're going to feel great. And, when you're pregnant, everything tastes good, highly palatable foods. You're like, delicious. A donut. Yeah, whatever.
Certain things don't even look good. You're like, don't look at me.
But the research is like really profound. It's, I don't know if you know Lily Nichols. She's like one of my faves, but when you look at the research, it's like people who eat the recommended amount of carbohydrates that tend to be highly processed, even like high sugary fruits, the difference in their weight gain over the period of gestation is to the tune of 20 pounds on average more. And their chances of gestational diabetes is almost twice as much. So it's like, there's something here, friends. It's not just...
Well, and what I'll say, I share my food on Instagram. I always kind of feel a little bit weird about it because I recognize the influence I have and I don't want people to look at my plate and think that's how they should eat. But people are always like, it just gives me ideas. And And I make like really simple food. Like I'm just seriously like scramble some eggs and throw like a handful of lettuce and throw something on. Like, and I aim to get 6 to 9 vegetables a day. And it's actually really easy because I've been doing it since I was like 21. So
I love that. That's such a good tip for everyone listening. Like, it's about nourishing and adding, right? Like, gamify your veggies, 6 to 9 veggies.
Well, I mean, that's the thing that, you know, in Beyond the Pill, we do take out foods. And I'm really clear to say, these foods are not bad. This is testing about what's true for you and what's not true for you. And, you know, it's a bit of an elimination diet. And people have said to me, but like you leave eggs in. And I'm like, yeah, because my patients haven't had issues with eggs. If you have autoimmune disease, possibly. If you have a family history of allergies, possibly. But like, and when I approach it in Beyond the Pill, I'm like, we're going to fill you up with so much food. You are not even going to notice. And I've always done this to my patients. So for people listening, I have a nutrition degree. When I was studying nutrition, I was counting macros. I was counting everything. Like I could do it. I could be like, oh, that egg, this many grams of protein, like this much fat. And like, I just got so good at it. And then I faded out of that. And what I found is that, I mean, God, this was back in the early 2000s and none of my nutrition clients did we count or weigh or do any of that. And they were like, back then they were like, oh my God, like, you just want me to be like more intuitive about my food. And like, and I just had a template where I was like, half your plate full of veggies, split it in half again, make it protein. And then the carbohydrates that work for you, you can look at putting in there. So people often look at my plate and they're like, you don't eat any carbs. And I'm like, I do. Like you didn't see the blueberries in that picture. You didn't see the squash. Like you didn't see, I'm in Puerto Rico right now. They have all kinds of like strange, you know, because I didn't grow up with it. It's all kinds of strange root vegetables and I'm cooking all of those. It's great for the microbiome to mix it up with stuff. And so, you know, to point out to people that vegetables have carbohydrates. And when I figured out is when I was following the food pyramid, I actually became orthorexic. It was like the worst thing for me ever. And I felt awful eating 6 grains a day. And I kept doing it and I felt awful and I wasn't listening to my body. And I was like, how do I just can't get all of these vegetables as well. And how do I do it? And I started to compromise and be like, well, I'm going to eat less grains. And then I'm going to replace that serving of grains with like, you know, more vegetables and start bringing that in. And I was like, whoa, I feel so much better. Like what is going on here? So with that, you know, I illustrate that because you have to figure out what works best for you. It will change throughout your cycle. So before your period comes, you're going to crave more carbohydrates. Why? You're a little more insulin resistant, making more glucose be around in case you get pregnant and like babies there. So, and then in pregnancy, it'll change too. Like everybody in the first trimester. So I'll get like paleo people or keto people. I don't recommend keto in pregnancy. We just don't have enough research on it. I have had patients who are like, I'm going to stick with this. And I'm like, your OB-GYN better be signing off. I'm not going to sign off on this because like, I'm just not comfortable. Plus like whoever is going to like see that baby into the world, that's who I'm like, that's who's boss, like during pregnancy. But with that, they're like, oh, I feel like such a bad person because like all I ate was chips today because I was so sick. And I'm like, everybody does that. Everybody goes through that where they're like, I'm just going to eat some rice cakes because I just don't feel good. Like, and you're not bad and it's not wrong. But just to recognize that like even in pregnancy, those things are going to shift as well. And you're going to find that like, oh, like, I mean, so many like vegan and vegetarian patients being like, I have to eat meat. Like, oh my God, I'm dreaming about it every night and I just don't feel good. And then it's like, we look at their iron levels and I'm like, you know, because you don't have enough iron. And then they make that dietary change. So it's all about what's true for you. And I don't believe in any dietary dogma or being like, everybody has to do one thing in one size. It just doesn't work that way. And if you think it does, I encourage you to go travel the world and see how everybody's doing things differently and like totally thriving. So, you know, when it comes to fertility, we've talked about the nourishing, sleep, dark cycles. Those really, really matter. So tending to your hormones. There's been research to show the worse your PMS is before you get pregnant, the higher the probability you'll have postpartum depression. And it's really, really common, you guys. And I was reading recently that the leading cause of death in mortality or death postpartum is suicide, because that's how bad it can be. I don't say that to scare you. I say that so you know that possibility exists, and you've got a lot of power in what you do before you get pregnant and a lot you can do to build that support system. So like my first book was on the 4th trimester and planning for postpartum. And I said to women so many times, like, we put too much effort and energy into the birth plan. And I hate to break it to you, but baby's going to do what baby wants to do. And like all bets are off in birth. I was like, I'm going to have a water birth and all this stuff. And I was like vomiting on my hands and knees, crawling around, and then a baby came out. Like that's like, oh, it's so beautiful. It's so wonderful, right?
Yeah.
But then, and at the time, my book came out of my experience with my son, because at 6 weeks, they check you and then it's over. And I'm like, but I need a lot of help and things are wrong and what's going on. And so we need to be planning for at least those first 12 weeks postpartum, because a lot changes with your hormones and your body altogether. So the more you can do preconception to get your body ready, the better chance you stand at optimizing your pregnancy, optimizing baby's health, and having a kick-ass postpartum the most you can when you're not sleeping and, something's throwing up on you and pooping on you and your nipples and your vagina's sore and weird stuff's coming out of your body. That's
Here we go.
Yeah, that's all they're like real talk about all of that. Because sometimes women feel like, well, why am I not having a kick-ass postpartum? Why is it so hard? Because
it's hard.
in this modern society where we don't have our tribe like we used to, is really hard. We were never meant to do it like this. So definitely, if you've got a hormone imbalance now, you've got to get that fixed. You need to know your thyroid now. Pregnancy is a stress test for your thyroid. If your thyroid is not right now, it's going to be much worse in your pregnancy. And is that like for everyone? No, but it happens enough that I can say, like, you need to get that tested. And so with my patients, just because thyroid disease is so rampant and it can also lead to a miscarriage. And even if it doesn't lead to a miscarriage, without having adequate T4 is what your thyroid makes. It crosses the placenta. It's what baby uses until about 20 weeks of pregnancy. T3 is what you use. It's your mood, your metabolism. It's what you poop. It's awesome. Makes you feel good, but baby doesn't need that. Baby needs T4. With that though, baby needs that for its nervous system maturation, which is all happening in those first early weeks. Like right after you find out you're getting pregnant, you are pregnant. Like here it comes a couple weeks later. So with my patients, I give them a standing order where I'm like, we get progesterone and beta HCG too, because I just want to see where their numbers are and pass that to their birth provider. But I get a full thyroid panel, because if I see, and sometimes I'm like, oh, your TSH is totally normal. I don't care if your TSH is totally normal and your T4 is low. If your T4 is low, that's a problem. And you'll need to, and people are like, I don't want to use a medication. I'm like, you want to give your baby the best shot, and we have to. There's no question. We have to. There's no waiting around for 20 weeks for your body to figure it out. And beta HCG, sometimes TSH will be like, if it's above 2.5, we're concerned. Sometimes it'll be like, 2.1, because beta HCG is stimulating your thyroid as well. But if that free T4 and that total T4 is not right, I'm like, just get it on, like get it on board, because it's much better that we have that available to baby and we can protect baby. So that's another thing we want to check. It is very, very, and sometimes I will say this, like, this is not the first place you go, but sometimes I've had patients where they've been trying for 6 months. They're under age 35. Everything's normal. If you're over, age 35 at 6 months, you have to go get in and get checked sooner. Sooner is better if you're not getting pregnant. Before age 35, you can wait like a year, but I still am like, if it's been 6 months, let's just check it out. Why wait? Because when you want a baby now. Like, let me just say that.
When we finally decide to do it, it's like, yeah, I wanted to get pregnant last month.
I know, right? I want a baby yesterday. What's going on here? So, with that in mind, I have had patients, like, we were trying like everything. We're trying. And we just give like 25 micrograms of Synthroid, and they get pregnant the next month. And their thyroid looks normal. And sometimes it's like, and I'm like, well, we just need a lot more research. And there's a lot of reproductive endocrinologists who will do this as well. This is not like a Dr. Brighten just made this up kind of thing. This is, a common fertility practice. But so when should you try to get pregnant? because you want a baby right now, you really should give your body like a good 3 to 6 months of preparation. So if you have a hormone imbalance, get it in check. You got thyroid issues, get it optimized now because it's much harder when you're pregnant, and you are going to have to shift things when you are pregnant. And you want the egg you become pregnant with really went through a 90-day maturation process. So that's when, in my patients, yes, we're working on all the hormones, but we're also bringing on antioxidants. And like, I'm going to tell you something. It is not cheap to do a fertility protocol. And I was just saying this with a friend of mine, and her and I were just chatting, and she's like, what do you typically do? And I'm like, I'm going to tell you it's not cheap. And she's like, you know how much IVF costs? I'm like, yeah, like, okay.
Yeah.
So just to put it in perspective, but bringing on things like CoQ10, it's usually 400, 600 milligrams, if not more. CoQ10, like, I'm going to tell you something. If your supplements are really economical and you feel like you're getting a deal, you ain't getting what you're paying for. Okay. Like you are kind of getting what you're paying for. You're paying for cheap junk vitamins most of the time. Like, having my own supplement company, I will tell you that, like, when we go through sourcing, and like, it is such a process, and they're like, you can get this one and it'll cost like 2 cents, or there's this one, like this ingredient, it's going to cost 20 cents. And I'm like, yeah, but that's like folate and they can actually use it. It's like way better. Like, I'd rather have the best thing. I take my own supplements too. So you guys know, I'm like very much like, I put this in my body and my family's body. Like, it's gotta be the best. Same. So CoQ10, alpha lipoic acid, getting in L-carnitine as well. L-carnitine, these are all things that help the mitochondria. Making sure you have magnesium, you have B vitamins on board. We may be bringing on herbs like, ashwagandha, turmeric, even rhodiola can be helping with the adrenal glands. Vitex, we stop those once you're pregnant, because unless there is really good data on herbs, I'm not going to continue it in the first trimester, because that's when teratogens, the entire foundation for the humans being set up. I don't mess around with babies. Okay. I'm like, nope. Unless like we've got a lot of data on this, we're doing it. So if you're on herbs, you need to stop them and talk to your provider. Some providers do use Vitex to help sustain a pregnancy and go through. You have to be talking to them. You have to be planning for that. Okay. That, like, you cannot listen to a podcast and be like, I'm just going to do this Vitex. Don't do that. Okay. Like, you want to keep your baby safe. But you can be on all these things ahead of time. And once you have that positive pregnancy test, then you stop. Vitamin E, vitamin C, those antioxidants. Vitamin A, definitely important, but we want to be mindful of retinol palmitate. So a little bit, that's okay. Eat your egg yolks, okay? Eat your animal fats. Like, those are going to have retinol palmitate in them. If you're taking a prenatal, it'll only have a little bit of retinol palmitate. That's because it's a teratogen. This is why you do not use a multivitamin in place of a prenatal, because sometimes a multivitamin will have 10,000 IUs of retinol palmitate. And we just don't know if that's going to be okay in your particular instance. A teratogen is something that basically it makes a monster. Like, that's what the root of the word. It's going to mutate baby, so to speak. So for lack of a better phrase. So with that, though, we do need vitamin A. Eat all your leafy greens. Eat your carrots. Like, get the beta carotene. You may have a genetic issue in that conversion. That's where you come in with your egg yolks. That's where you come in with, like, eating, if you're going to eat red meat and things like this that have the vitamin A and the fat, like eat chicken skin. It has the fat in it. You're going to get that vitamin A, or take a supplement with a lower dose. So I'm just always mindful, because there have been some studies that are like, it's not just the vitamin A you took while you were pregnant, it's what you were taking before you were pregnant. So if you are going to get pregnant, switch over to a quality prenatal and start that now, so that you've got the right stuff going on. And then one thing I will say with prenatals that I always say to look for is the right balance of selenium and iodine. So sometimes prenatals will just have iodine, or they will have like 150, 200 micrograms of iodine and like 50 micrograms of selenium. If you have Hashimoto's, like a whole lot of people do, that can actually cause your antibodies to go up, and it can be problematic in this process. So you want to, the ideal and what we put in our prenatal is 200 micrograms of selenium, great for helping with glutathione. And we love to have NAC on board with that as well, especially with our PCOS patients, to help with fertility as well. NAC can help with blood sugar. I got a whole article on NAC. You guys can like go and look at.
We'll link to it.
Yeah. But with that, 200 micrograms of selenium, and then having that iodine, and that iodine can be at 150, 200 micrograms. you're also getting iodine from your food. So keep that in mind. Because in pregnancy, they will say like, oh, you want like 300 micrograms, but we don't want to do 300 and then have you also eating more. Iodine is good. It's very important for baby, brain health, so much goodness to it. But just like everything else, too much of a good thing is just a bad time. So you've got to be mindful. But iodine and selenium can be really important nutrients to have on board for fertility as well. So I just like offloaded a ton of stuff. I want to say to everyone, this is not medical advice. And if you are struggling, you need to meet with a medical provider. I'm just giving you general information. I've been like falling all over my words today. But just general information for you to start writing down and to have a conversation with your doctor about. Because your doctor might be like, oh, we're doing this antioxidant blend. And you're like, what do you think about NAC? There's been some great studies with that. I have all the studies linked on my website as well. And with that, your doctor might be like, it's actually like a really good idea. I've been looking at these parameters. Like, I mean, most good doctors will do that. They'll be like, oh, that's interesting. Let me like think about that in the context of your case a little bit more.
Right. Definitely. I mean, I love it because I don't think people really take the time when they decide they're going to get pregnant. They don't think about it. They're not foreshadowing it. They're just like, okay, now feels right. It's January and I've been waiting till I was this age or married for this long and now let's do it. And they haven't taken the time to do an antioxidant plan to really like look at their prenatal, make the switch from a regular multivitamin to a prenatal and like prepare their body in the right way.
Yeah.
So I love all this so much. And I love it too, from a nutrition standpoint specifically, because when I think about those 3 months prior to getting pregnant or 6 months prior to getting pregnant, the maturation of that egg, really like your body's stores of nutrients and going into your first trimester, being the saltine cracker or rice cake kid, feeling horrible about it. It's such a good feeling to know like, no, actually like I got my nutrient stores up. Prior to pregnancy, I took really good care of myself. Like baby can deplete me right now. And then when I start feeling better, I can start eating to refill those tanks so that when we go postpartum, we're not depleted again.
Yeah. And I mean, that's the thing for people to recognize is that, pregnancy is energetically and nutrient demanding. Postpartum is where all your nutrients are going to get gobbled up. We're not eating for 2 while you're pregnant, which kind of sucks because it's not as fun, right? Like, you're a foodie. I know, but it's but in postpartum, that's usually when people start eating a lot more. And that's actually when your nutrient requirements go up way more because now you're not just like passing it to the placenta and be like, here you go, through via the umbilical cord. But now you're like lactating, like you're using more energy and more nutrients. And so to remember that, most people are like, oh, do you just take a prenatal? No, I'm not pregnant. You need to stay on your prenatal. I tell my patients for as long as you're breastfeeding. For as long as you're breastfeeding, stay on your prenatal because you need all those nutrients. And I will hear sometimes doctors like, you don't need to do that. You just need to have a good diet. So are you a parent? I don't understand because there are definitely days where I'm just like, oh, dang, like I'm like eating what's left over on my kid's plate. Like, and then there are people who have more than one kid. Like I have one kid. I'm like that kind of thing, that prenatal is like kind of the safety net there. And you need more nutrients than you can sometimes even get in your diet, just depending on like, even when you have like a C-section and you're breastfeeding, like you're not just healing from the baby, you're healing a surgical excision here. Like you need more nutrients. If you went through a surgery, I'd be like loading you up on nutrients. Then something happens where like, oh, there's a vagina involved, whatever. Like you don't need prenatal. No, like you're like next level, need more support. And it's just the thing in women, it's like an athlete would get knee surgery. People would be doting all over them, being like, get their diet in check, get those supplements, get everything going. And then you like go through having a baby and people are like, oh, you're good. Rub some dirt on it. You'll be fine. Like,
seriously. Seriously. It's like, you're glowing. I'm doting on you. You're pregnant. And then postpartum, they're like, who? Yeah. Oh, let me hold the baby. What about you? Oh, I don't know.
Oh, you're pregnant? Let me open the door for you. Oh, hold it for you. Oh, you have a baby? I'm going to run ahead and like get through that door so I can get away from your child as fast as possible. Yeah.
Oh, I love it. Oh my God. You're such a blast, Dr. Brighten. Thank you so much. This has been really fun. And I think really informative for people to like, if they are in the car listening, they're definitely going to have to go back and listen again, grab their notepad, write out all the hormone changes, write if you've lost your period, go back to that section on the podcast and, go through the potential medical reasons why you may not have a period and ask your doctor to do the same, because this is empowering you to take your own health into your hands. I love it so much. You've been such a joy to have on the podcast. Thank you so, so much for being here and giving us your time.
Yeah. Well, thanks so much for having me. It was really fun to be chatting with you today. I really hope this information helps everyone who's listening. It
definitely will. So we end our podcast the same way every time with one last question. And that is, what does body love mean to you?
So body love, like when I hear that term, what I think about is unconditional love, which is something that we kind of think it comes naturally. Like we often think about it in terms of like parents, like unconditionally loving their children. And yet it's not something that comes naturally to a lot of people unless someone has really modeled it for you. And so we can have this conditional love where like, if we're talking about children, it's like, if you get this done, then I'm giving you a hug, right? And with our own body, we can do the same thing where it's like, well, you went and burnt 1,200 calories today. So, or you did 10,000 steps. So like, I'm going to like praise you. And sometimes we don't even take the time to do that. And so, when I hear body love, I think about it just being an unconditional love of like, I love you, even when some days it feels like you're failing and you're not at your best. And that's because like what do you need from me? Right? Like whenever my child's having issues, I think like, what do you need from me? Like what's going on here? And so just to recognize like how incredible that this complex biological system is that you are working with and you're in harmony with like every single day. It's not a vehicle just trying to race you to the death finish line here. It is really in it with you. And so to have that unconditional love and to be gentle with your body, even when it doesn't look like or feel like or act like what you want it to be, it will never look like, other people. And you should be celebrating that, things that were not told. I wish someone would have told me that at 7. Like you're never going to look like that girl in the magazine because you look like you and it's just perfect. So with that body love, having that unconditional love and really honoring and respecting like your physical, emotional, spiritual, and just encompassing all of your needs.
Oh, I love your answer so much. It's really beautiful. It's not conditional love. And when we're crying out for it the most, it's like when we need the most love, right?
Yeah.
I love that. Well, where can people follow along? We'll definitely link to your website and your Instagram and everything on social, but let everyone know who's in their car so they can
you can
find you on Instagram.
Totally. Well, you can find me. My main hub is drbrighten.com, drbrighten.com. If you go there, and you type in /hormone kit, we'll give you a free meal plan recipe just on how to get started on eating to optimize your hormones. And you'll get a whole lot of information too, of just like understanding your body. You can also find me on Instagram and TikTok. I love playing on TikTok at Dr. Jolene Brighten. I'm also on YouTube. I'm on Twitter, but I don't hang out there. Let's just be real. Twitter and Facebook, I'm like, nah. Not anymore. But yeah, so main place to interact with me is Instagram and TikTok and YouTube, I would say.
Awesome. Well, we will link to all 3 of those platforms and also to your free hormone kit. So that's great.
Cool.
Thanks for your help today and for coming on and for just sharing so much good knowledge. I really appreciate it.
Yeah. Well, thank you so much for having me.
Thank you for listening to Be Well by Kelly. Please subscribe to the show on Apple Podcasts, Spotify, or wherever you listen to podcasts. Learn more at bewellbykelly.com and follow me on Instagram at bewellbykelly. I would love if you picked up my books, Body Love and Body Love Every Day. They're sold on Amazon and at all major booksellers.